men are notoriously and even comically bad at listening to their bodies and responding appropriately. We're all human. Our biology is very, very similar. Just because our biologies are similar, that the differences aren't important. The truth is that men present with heart disease 7 to 10 years earlier than women do. Men are 3 times more likely to die by suicide than women, and most of those occur after the age of 65. Medicine doesn't do politics. Medicine is concerned with people. Diet, movement, sleep and recovery, and relationships are where you need to start before you start digging any deeper into your overall health. You have to take care of yourself first, because if you don't do that, you're not going to be around to take care of those that you truly love. I'm Dr. Jeremy London. I'm a board-certified cardiovascular surgeon, and I've been in clinical practice for the last 25 years. Today, we're going to talk about men's health. Now, let me be clear about who this podcast is actually for, because it may surprise you a little bit. Yes, obviously, it's for men and about men. But I can tell you that after many years at the bedside, there's something that I have seen over and over and over again, something that I would bet money on. And that's that for every man that shows up to get his scan, that responds to his symptoms, that shows up for his operation, there is a woman behind that scenario that is supporting him, pushing him, questioning him to actually follow through and not to fall into the let's wait and see what happens their way to the grave, if you will. So this is also for the women in people's lives, because men are notoriously and even comically bad at listening to their bodies and responding appropriately. So I'm very grateful for all of the women and the patients that I've taken in the lives of the patients that I've taken care of, because without their love and without their continued support and the pushing, many of these men would never have actually showed up. And I can tell you from my own personal experience that I am so incredibly fortunate that I have a wife that loves me enough to be my true north and to keep me on track, which I need a lot. 3.5 years ago, I had a cardiac event myself. And for over 24 hours, I wrote it off as being nothing more than reflux. When I finally came clean of what had been going on for the last 24 hours, she literally looked at me and said, well, why didn't you go to the emergency room? And I said, well, because I didn't like the cardiologist that was on call. And she looked at me and said, well, that's what you do when you have chest pain. And she paused for a minute and then said, this is the most selfish thing you've ever done to me and the boys. And I just looked at her and said, you're right. And I get goosebumps every time I repeat that sentence. But it was really because of her insight and her willingness to keep me on track and to do what I needed to do, that I eventually ended up at the hospital in the cath lab getting a stent in my right coronary artery, and I've done incredibly well ever since. So this episode is for all of those women, the wives, the sisters, the mothers, the friends that have had the continued love and stubbornness to make certain that the men in their lives follow through with what they need to follow through with and actually show up. And to the men, I'm going to say this now and I'm going to repeat it at the end, that you have to take care of yourself first. Because if you don't do that, you're not going to be around to take care of those that you truly love. And that's really what this episode is about. It's for both the men and, as importantly, as the women in their lives. Before we jump into this, I do want to make an observation that I think is very important. For much of medical history, most of the medical studies and data were focused on men. And we just thought that women were smaller versions of men. We studied men's heart attacks, men's diabetes, et cetera, et cetera, et cetera. And women really paid the price for this with misdiagnoses, delayed diagnoses, and even the ultimate cost potentially of their lives. And interestingly, it wasn't until 1993, which really wasn't that long ago. If we look at the history of medicine, and if you're my age, it really wasn't that long ago. That was the year that I graduated medical school. That was the first year that there was true legislation for federally funded grants that women must be, in fact, included. And up to that point, they were actually actively excluded from studies. So I want to make certain that the point of focusing on men's health today is not because I don't think that all of the work that has been done to bring women's health to center stage isn't important. They certainly have earned it the hard way. But the bottom line is that medicine doesn't do politics. Medicine is concerned with people. And we really need to look at this in a very balanced fashion. So shifting to men here for a second is not a condemnation that women have been in the forefront. What we want to do is to look at all people, not one versus the other, but alongside of each other. And we're going to do that. We're going to talk about where the lines cross, and then we're going to look more specifically where there are differences. So let me lay out the structure of how I think about these things. It's really two layers. And the first layer is the foundational layer. And this includes both men and women. And these are things that are applicable to all human beings. These are the really foundational components, the levers that most of us are very familiar with. Whole foods diet, exercise, sleep, social connections, real connections. These are the pillars that set the base on top of which everything else is based. And these are the things that truly move the needle with longevity, with health span, with lifespan. And if you take nothing else away from the talk today, remember that diet, movement, sleep and recovery, and relationships are where you need to start before you start digging any deeper into your overall health. And this is the true common ground for all of us, man or woman. The second layer is where the sex-specific medicine lives, with different hormones, different anatomy, different timing of disease onset, all of these things. And this is really where people get tangled up, that when we focus on men's health or women's health for that matter, that somehow the other one is not as important. And that's simply not true. Both are important and both require equal attention so that we can become more specific in the way we treat those differences. And of course, there's overlap here as well. We're all human. Our biology is very, very similar. So don't let anyone tell you that just because our biologies are similar, that the differences aren't important. The differences are actually expected. And many times, it's these differences where people actually fall through the cracks. Let's look a little more closely at these potential cracks specific for men. And so let's start diving into this list. And this first one really stays in my wheelhouse, and that's the heart or cardiovascular medicine. And the truth is that men present with heart disease 7 to 10 years earlier than women do. And the proposed theory or proven theory actually of why this occurs is that women prior to menopause have the vascular protective effects of estrogen. That, of course, decreases after menopause. Now, what does that mean for men? Well, the opportunity window for lifestyle interventions is much earlier than many people think. As opposed to 50s and 60s, the opportunity is really in the 30s and 40s before problems actually arise. What does this mean from a laboratory standpoint? Well, not only are they presenting earlier, but because we don't have those protective mechanisms, then LDL cholesterol, non-HDL cholesterol, triglycerides, all of those things are actually more impactful on cardiovascular health in men than they are in women. So how do we deal with this? Well, we want to make sure that we are following LDL cholesterol for sure, because we know higher is bad, lower numbers, earlier intervention is better. And now with ApoB, apolipoprotein B, as an option for laboratory values, this actually gives us a granular picture of the atherogenic or dangerous molecules that cause heart disease. So making certain that you're at least following those labs, following those earlier so that you can actually intervene is certainly something that needs to happen. Another laboratory test that most people either haven't gotten or maybe have never gotten is LP little a, or lipoprotein little a. And this is a genetically determined LDL variant, if you will, that really, for men in particular, you only have to check it once in a lifetime. Now, if it's high, we don't have a medication right now that actually can lower that. That is in phase 3 clinical trials. But what it does is, with and in concert with your healthcare provider, you can work really hard to lower all of the other risk factors that you possibly can, because we know that if you have a high level of LP little a, you are at a dramatically increased risk of cardiovascular disease. The next item on the list is one that most people don't want to talk about or even acknowledge, and that is erectile dysfunction. And you may be thinking, why is this even related to a cardiovascular or overall health conversation? Well, let me explain to you why. This is really not a bedroom problem. This is a vascular problem at its core, because the small arteries in the penis are what are actually controlling erections. These arteries are 1 to 2 millimeters in comparison to the arteries in the heart that range anywhere from 3 to 4 millimeters. So which arteries do you think get affected first when there's damage to the endothelium, to that inside lining? Where do you think this shows up first? In these small arteries. So erectile dysfunction can be a very early sign of atherosclerosis. And it's not something that you want to just write off as something I don't want to talk about and I'll take a little blue pill. This needs to be something that needs to be evaluated. You need to have your heart checked. Let me read you some statistics. The numbers truly back this up. Men with erectile dysfunction have roughly a 45% higher risk of cardiovascular disease, about a 55% higher risk of heart attack, and about a 36% higher risk of stroke. New onset erectile dysfunction typically precedes symptomatic heart disease by 2 to 5 years. And now it is actually included in the major consensus guidelines that recognize ED as a predictor of coronary disease. So my advice to men is that this is not some problem that you want to keep quiet and you want to fix quietly. And to the women or their partners in their lives that are noticing that this is going on, this is not an opportunity or necessarily a situation for embarrassment. It should be a red flag that we need to head down a different road and make sure that the cardiovascular system is not already at risk. We want to take a minute and thank the sponsor of this podcast episode, Element. Now, hydration isn't just about drinking more water. It's about replacing what you lose. When you sweat from workouts, sauna sessions, or demanding jobs in the heat, you're not just losing water. You're losing electrolytes like sodium, potassium, and magnesium. That's why I choose Element as my electrolyte replacement of choice. Element's formula uses a science-backed ratio of sodium, potassium, and magnesium, and it truly tastes great. Electrolytes are used by every cell in your body, and even minimal dehydration can limit both cognitive and physical performance. Now, who benefits most from Element? If you exercise regularly, enjoy the sauna, or have a physically demanding job, replacing your electrolytes could make a difference. I mix a packet of Element, usually my favorite flavor, which is grapefruit salt, in 32 ounces of water before the gym or a run to ensure that I'm well hydrated. If you want to try Element for yourself, head to drinklmnt.com/London and you'll receive a sample pack of 8 of their most popular flavors with any purchase. That's drinklmnt.com/London, and they offer a no questions asked refund policy. So you can buy it, try it, and if you don't like it for any reason, they'll give you a full refund. Now let's get back to the podcast. Our next topic, testosterone, is one that I think is really important to address because I don't think that there is one that is more polluted by marketing than this one. So let's look at true testosterone deficiency. Most of the time, this is not due to a failure of testicular production of testosterone. It certainly can be, and there are medical conditions that are proven as such. But when we look at low T, what we're really looking at is much more of a metabolic problem. It's a downstream problem from increased visceral fat, or the fat that surrounds our organs in our abdomen, decreased muscle, decreased exercise, poor sleep, increased stress, alcohol, all of these things combine. Now, why is visceral fat and being out of shape such a problem? Well, there is an enzyme called aromatase that converts circulating testosterone to estrogen, thereby lowering your overall testosterone levels and increasing estrogen levels if you have excess visceral fat. That now brings us back to this foundational conversation about the pillars. What truly moves the needle in this situation to get out of this really dangerous round and round cycle of you get more out of shape, you make more testosterone, you have more aromatase, it breaks down more testosterone, you have more estrogen. That's really to lean heavily into the pillars, to decrease your visceral fat, to increase your muscle mass, to work on your sleep, to supplement with things like vitamin D if yours is low. Those are the things that really make a difference. What are the things that don't? The test boosters that you find at your supplement store. Be very, very wary of those. Now, do true low testosterone states exist for individuals that it's not testicular in origin? Absolutely. When do you diagnose something like this? After the foundational work has already been done. Now, there's a lot of variability in the absolute numbers of what constitutes low testosterone, but the probably the most common number is around 300, and that's pretty consistent across labs. But this is something that you have to discuss individually with your doctor or your healthcare professional. What you want to do is make certain that this is someone who is comfortable with hormone manipulation and not a wellness clinic that hands out testosterone like candy. Now, testosterone, interestingly, is one of these places where there is overlap with women, and that might be very unexpected for many people because we consider it the men's hormone, and it is the primary men's hormone, but women have testosterone too. They make it throughout their lives, and it does decrease over time like many other hormones. In what situations do women truly benefit from testosterone treatment? The only thing that's really proven is a decreased libido or decreased sex drive. When we look at things like mood or fatigue, the softer items, those things are really off-label. But if this is something that you're interested in and you haven't looked into more deeply, again, I recommend that it's with someone who has expertise in this area. But I think the interesting dynamic here is that we have men where this has been over-marketed and probably overused in many, many circumstances because it's easily accessible. And for women, there's been no light really shed in this area, and it's been underused as a result. So this is one of those interesting places where it's really important to understand it's not men versus women. It's all of us together. How do we each benefit and benefit differently in different scenarios from the same drug? The next category is screenings that men skip or fumble. So let's be realistic. It's a grim reality that men are not really reliable when it comes to keeping these appointments. And so many times, mortality is not based in some exotic scenario. It's just not showing up. So I want to go through some of these specifics just to highlight them. Some are heart-related, some are just health-related, but I think they're really important when we're talking about overall men's health. And this has had a lot of press over the last few years, and there's a lot of variability. And the reason there's variability is because it's really patient-specific. It's based on your risk. It's based on a discussion with your healthcare provider. I am not a urologist. This is not something I do on a regular basis. That said, what has happened over the years is that when it was a blanket statement that every man needed a PSA, there were a lot of unnecessary biopsies and consequent tests and potential complications for those things that probably didn't need to happen. So this really needs to be tailored to you. What are the things that are high risk? Well, let me give you a few of them. If you have a family history, you have other reasons that you might be higher risk, you're age 40 to 45, particularly of Black ancestry, those folks definitely need to be screened. Black men carry roughly double the risk of dying from prostate cancer, which is exactly why the conversation needs to start earlier or more often for them. So this isn't something that you blindly demand or blindly refuse. It's something that you really need to have a conversation about to see if checking a PSA is right for you. We want to take a minute and thank the sponsor of this podcast episode, Rora. Now, hydration is truly foundational for our mental and physical performance. The problem is that our tap water may contain contaminants that can be harmful to our overall physiology. These chemicals can disrupt hormones, fertility, and even your gut microbiome. In fact, 95% of U.S. water systems tested positive for at least one carcinogen. That's why last year our family started using the Rora countertop system. In my opinion, Rora makes the best water filters on the market. Rigorously tested by NSF, the Rora filtration system is proven to remove lead, forever chemicals, microplastics, and 50 other contaminants. And unlike other filters, Rora removes harmful substances while keeping the beneficial minerals like magnesium and calcium in your drinking glass. It takes less than 5 minutes to set up, and it looks great in your kitchen. If you want to start filtering your water with Aurora and save 25% on your countertop system, head to Rora.com/London. That's RORRA.com/London. Now let's get back to the podcast. The next is screening for an abdominal aortic aneurysm. Now, what is that? That is a thinning or ballooning of the aorta in the belly that over time will continue to grow, and there is a significant risk of rupture. If you are age 60, 65 or older and you have ever smoked, you simply need a non-invasive ultrasound of the abdomen, which just like the ultrasounds they do during pregnancy, to determine whether or not you have this. The mortality from a ruptured aneurysm is around 80%. We decrease this by more than half by screening for abdominal aortic aneurysms. There is no equivalent like this for women, but I can tell you this is one male-specific test that if you fall in this category, you just need to get it done. The next on the list is osteoporosis. Yes, in men. We think about this as a process that only affects women, but that is not the case. 1 in 5 men over the age of 50 will have a significant fracture as a result of osteoporosis, and most men never get screened because it's really not thought about. So who really needs to be screened? Well, age over 70, the DEXA scan or bone density scan makes really good sense to identify. Or if you fall in a high-risk category, you take corticosteroids, smoking, alcohol abuse, liver failure, these things all put you in high risk for osteoporosis. And here's the real twist, is that men that have fractures from osteoporotic lesions have a significantly higher mortality than women do. So it pays to think about this, have this discussion with your physician, and decide whether a DEXA scan or bone density scan is appropriate for you. Colorectal cancer, this one is quick and clear. Screening either with colonoscopy or stool-based studies at the age of 45 absolutely move the needle to pick up early cancers. Men are notoriously bad about getting their colon screened. I was 55 before I had my first colonoscopy. I'm embarrassed to tell you. Just kept putting it off. I will tell you this. It is not nearly as bad as everybody says it is. I actually did mine without anesthesia because I was working that day. So no sedation. Took a total of about 6 minutes. It was totally normal. And it was something that I should have done much earlier. Colorectal cancer is one of the most treatable cancers when caught early. And we certainly can do this with colonoscopy and early stool screenings. The final one in this category is testicular awareness, and this is particularly for younger men. Now, routine evaluation for testicular masses is not recommended, but having younger men aware and doing self-exams so that there is a new growth, new mass, new area that has changed, that you are evaluated, because testicular cancer is the most common solid tumor that we see in young men. And this isn't to create anxiety, but simply to create awareness. Now, look, if we look back at this list that we've just talked about, none of these things are failures of the medical system necessarily, or anything really novel or high tech, if you will. This has to do with patient engagement and just getting an individual to walk through the door. So while we're staying below the belt, let's just kind of hang out there for a minute and talk about 2 other areas that I think are really important for men. And the first one is BPH, or benign prostatic hypertrophy. And this happens to all of us. About 50% of the men over the age of 50 have it, 80% of men over the age of 80, and it's a benign enlargement of the prostate. Now, here's the interesting thing, is that this is also a metabolic problem that can be addressed through diet, exercise, sleep, stress management. It has a huge impact on how the prostate responds. Now, after you've done all these things, there's certainly medications that exist that work really well, but you don't have to jump right to those things. Go back to the foundational pillars first. Make certain that you've checked those boxes before you head down that road. And more importantly, if you're younger and you don't have this issue yet, start now to avoid it altogether. And the final one in this category is one that most of us associate for women only, and that's Kegel maneuvers, or training the muscles of the pelvic floor. But let me give you some interesting context. Number one, strengthening the pelvic floor is the most effective way to treat male incontinence, particularly for patients that are having prostate surgery. The numbers are dramatic. The risk of having incontinence after prostate surgery is over 60%. For patients that do Kegel maneuvers and strengthen the pelvic floor, they drop that down to around 3% in the initial postoperative period. So something that should probably be on every pre-op checklist is strengthening the pelvic floor 2 to 3 weeks before you undergo pelvic surgery. And I just think this is another interesting intersect of things that we think are exclusively for one sex or the other. The dynamics of the pelvic floor are very similar in both of us. How they impact us are very different, but strengthening those muscles can have a significant benefit in certain patients. Now, this last category includes 2 silent killers: sleep apnea and male depression. And I really want to get these 2 across because, number one, they're very important, but number 2, they are categories that individuals may not recognize in themselves, and that it's the ones around them that can really make a difference in helping people identify that these things exist. Sleep apnea is the first one. This is snoring, waking up exhausted no matter how much you have been able to sleep. And who notices that? Not the individual, it's the person sleeping next to them, listening to periods where they actually stop breathing. Now, this isn't just something to think as, well, I just need to lose weight because it's a problem, because people that are of normal weight can still have sleep apnea. The reason that it's important, particularly from a cardiovascular standpoint, is because sleep apnea increases the risk of high blood pressure, triggers atrial fibrillation, and it increases the strain, particularly on the right heart. And all of these things combined dramatically increases the cardiovascular risk. So if you've been noticing these things, it's not just a matter of sleeping better, it's that too. But it really encompasses your entire cardiovascular, metabolic, and physiologic health. And the second in this category is male depression. And the statistic that really got my attention is that men are 3 times more likely to die by suicide than women. And most of those occur after the age of 65, when you would expect that men had reached, or anyone had reached, a point in their lives where they have found personal and professional success and were kind of on their train, if you will. But that's really not the case. And I think one of the reasons that we're missing this particular group of individuals' depression is because we're not looking for the right things. The typical symptoms of sadness and less joy and all of those things that come out on the depression tests that we currently use are not typically how older men present. The symptoms that older men present with are anger, withdrawal, pushing themselves deeper into work or some activity, alcohol or drug abuse. So we're really missing an opportunity to identify individuals that have fallen into a depression later in life because we're not looking at the right metrics. Now, this is changing, but again, if you have recognized these symptoms, quick-tempered, withdrawn, drinking more, let that be a red flag. Tune your radar in a little more sensitive way, and think about if this individual may in fact be depressed. Because depression and loneliness in particular later in life is a risk factor for cardiovascular disease. And you know, our social circles, typically as we get older, they focus around the people that you're working with. Then you retire and that group gets even smaller. And loneliness in and of itself is a compounding cardiovascular risk factor. So these are things that can quietly live amongst you without even realizing that they are directly impacting overall health. So let me bring this back to where we begun. Historically, women were excluded from the medical literature, and that is changing, and I want that to continue. But I certainly am not interested in the pendulum swinging the other way as, now it's our turn. It really needs to be both. And understand that it's this specificity that truly saves lives, that identifying the cracks and the differences to where these things exist are where we can truly move the needle. And remember that this is 2 layers. It's the foundational layers: diet, exercise, sleep, connection. That's the base. And what lives on top of this, don't forget about the early onset of heart disease. That erectile dysfunction may be your earliest sign. Check your Lp(a) to make sure you don't have a genetic abnormality. Make certain that your bones and your muscles remain strong, and that your connections and your social circles remain intact, and that you're sensitive to your overall mental health. It's these things together that compound. It's not one versus the other. And it's this mindset that allows us to build sex-specific plans for individuals without any type of bias, but making certain that we're actually taking care of the patient in front of us in the best possible way. And to the women that have made it to this point in the podcast, to the wives, to the sisters, to the mothers, to the friends, thank you for loving and supporting the men in your lives enough to push them to show up and to take care of themselves. And I hope that this gives you some basis on which to continue to push, so that you have this 2-layer foundation, that you can really build that support on something meaningful. And to the men, we are the ones that are willing to show up, to carry, to fix the roof, to take care of the car, to be the caretaker in the family. What I ask of you is that you give 1 ounce of that attention to yourself and to your own healthcare and your own well-being. Take care of yourself first, because otherwise you won't be around to take care of anyone else. If you have made it to the end of this podcast, thank you so much for your time. I truly do appreciate it. If you enjoy this type of content, please check out our free newsletter. We'll drop the link below. If you've been watching on YouTube, please follow and subscribe. If you're listening on Spotify or Apple Podcasts, you can leave up to a 5-star rating. Please follow so that you get notified of future episodes. Thank you again, and I hope you guys have a great day.